Picture this. You're out on the open ocean, days away from the nearest mainland hospital. You've booked the absolute trip of a lifetime to see some of the most isolated, breathtaking environments on Earth. But somewhere along the journey, an invisible, literally impossible threat boards the ship. Welcome to The Explainer. Today we're unpacking a fast-paced, high-stakes medical mystery currently unfolding at sea, one that has global health authorities scrambling for answers.
3, that is the devastating number of people confirmed or suspected dead from an infection that absolutely, scientifically should not be spreading on a passenger vessel. When people get sick on a cruise, we expect certain familiar bugs, but the pathogen we're talking about today is something so incredibly rare in this environment, it has completely blindsided medical experts.
Okay, let's dive into this. What exactly happens when a rare, deadly pathogen sneaks past security and infiltrates a confined vessel carrying around 150 passengers from all over the world? How does a disease known for hiding out in rural barns and dusty sheds suddenly start claiming lives in the middle of the Atlantic Ocean? Well, to understand this mystery, we first got to retrace the ship's incredibly isolated steps.
Section 1. Tracing the fatal voyage.
The MV Hondius wasn't just taking a quick weekend jaunt down the coast. About 3 weeks ago, it left Ushuaia, Argentina, a place literally called the end of the world. From there, it set off for the Canary Islands, making stops in mainland Antarctica, the Falkland Islands, South Georgia, and incredibly remote outposts like St. Helena. I really want you to imagine the geography here. These passengers were a world away from major medical infrastructure when the crisis hit. When you get critically sick out in the South Atlantic, help isn't just an ambulance ride away. It's a massive, multi-day logistical nightmare.
And unfortunately, the timeline of casualties reflects that harsh reality. According to Foster Mulholly over at the National Department of Health in South Africa, the sequence of events was terrifying. First, a 70-year-old male passenger developed a severe fever, headache, abdominal pain, and diarrhea. He tragically died right upon arrival at St. Helena Island. Then his 69-year-old wife fell ill on board. She later collapsed and died at an international airport in South Africa while desperately trying to fly home to the Netherlands. Finally, a British national got terribly sick while the ship was traveling to Ascension Island. He had to be rushed to a private South African health facility in Sandton, where his lab test results came back positive.
Section 2. What is hantavirus?
So, what's actually hunting these passengers? The World Health Organization confirmed it's hantavirus. This is a super rare family of viruses carried by rodents. But the crucial point you need to understand is how transmission works. You typically get it by inhaling particles of dried deer mouse droppings or urine. Think about sweeping out an old, dusty shed or exploring an abandoned cabin. That's where people usually catch this. You do not catch it from the midnight buffet line on a luxury cruise.
And the progression of this disease is incredibly brutal. Step 1, it mimics the flu. Starting with a fever, chills, body aches, and headaches. It totally flies under the radar. But step 2 is where the danger spikes, and severe respiratory symptoms develop rapidly. By step 3, patients experience devastating shortness of breath that leads straight to lung or heart failure. It is a terrifyingly efficient killer. You might actually remember this disease making headlines last year when actor Gene Hackman's wife tragically died from its effects. It's rare, but when it strikes, it is devastating.
Section 3. The impossible infection.
Now, what's really interesting here is the stark contrast. When we think of common cruise ship illnesses, we instantly think of norovirus or coronavirus, right? Pathogens that are highly contagious and jump from person to person. Ships, by their very nature, can be incubators for human-to-human bugs. But hantavirus, it is strictly rodent-borne. The sheer anomaly of seeing a dried rodent droppings virus on a pristine passenger vessel is what has everyone scratching their heads.
And you aren't the only one surprised by this. Listen to Dr. Emily Abdullah from the University of Michigan Medical School. She stated it plainly. 6 people sick on a cruise ship? I've never heard that from this kind of infection. Experts like her theorize that the virus might have come from droppings hidden deep on the ship itself or maybe encountered at one of the remote docks. But there's actually a much darker theory emerging from this tragedy.
The plot thickens with the Andes virus exception. See, according to the CDC, the only strain of hantavirus ever documented to spread from person to person is the Andes virus. And where's the Andes virus found? South America. Remember where the ship departed from? Ushuaia, Argentina. Because of this specific geography, Dr. Abdullah points out that the terrifying possibility of human-to-human spread is actively on the table here, a literal nightmare scenario for a confined cruise ship.
Section 4. Containing the spread.
The international response has kicked into absolute overdrive to stop this dead in its tracks. Right now, there is 1 laboratory-confirmed case and 5 additional suspected cases out of the roughly 150 passengers. The World Health Organization isn't just monitoring the situation, they are actively coordinating a massive multi-country response involving all the affected islands and nations. Meanwhile, health authorities in South Africa are conducting urgent, frantic contact tracing. They are mapping every single step, interaction, and breath of those affected. But while the medical hunt is highly dramatic, officials are working really hard to balance that urgency with objective facts. Foster Mahali issued this crucial reassurance. There is no need for the public to panic because only 2 patients from the cruise ship have been within our borders. The goal right now is hyper-focused containment. They are locking down the variables to ensure this anomaly doesn't become a wider global tragedy.
And this brilliantly illustrates just how crazy this situation is. 890. That is the total number of hantavirus cases reported in the entire United States from when the CDC began surveillance back in 1993 all the way to the end of 2023. Over 30 years of data, and we haven't even hit 1,000 cases in the US. It is profoundly rare. And yet 6 individuals are linked to this single isolated cruise ship in the Atlantic.
Which leaves us with a lingering, unsettling question. Was it a stowaway rodent carrying a fatal pathogen? Was it an unlucky shore excursion on a forgotten island? Or are we witnessing the rare Andes strain spreading human to human at sea? As the WHO frantically hunts for the source of this outbreak, you have to ask, what other deadly impossibilities is nature hiding just beneath the deck? Thanks for joining me on this explainer. Stay curious, stay alert, and I'll see you next time.